All right, all right. Good morning, good afternoon, good evening, depends on where you are connected with us. My name is Emmanuel Adigbola, and I'm so excited to welcome all of you to today's episode of Kina Earth Show. So today we're going to be continuing from where we stopped in the last episode, talking about medication madness. Medication madness. So today I'm going to be allowing our guests, our panelists, to introduce themselves. So you just go take it one after another. So let me start from Obika. Just go ahead and introduce yourself to our viewers.
Hi, my name is Obika, and I'm a pharmacist here in Texas. I work in Mineral Wells, Texas, at a retail pharmacy, and I'm glad to be here to uh, help share my thoughts on any questions that you all have today. Thank you.
Awesome, awesome. And over to you, Udo.
Hello, everybody. My name is Udo. I'm a pharmacist here in the UK in London. I'm also a retail pharmacist. We refer to them as like community pharmacists. Yeah, and I'm also happy to be here, ready to share my outlook on pharmacy on as a whole and my outlook on pharmacy like in the UK as a community pharmacist.
Awesome, awesome. Wow, I'm so much excited about today. Ready to learn from you guys. And over to you, Nestor. Can you hear me?
Yeah.
Okay, can you go ahead and introduce yourself to our viewers?
Hi, good evening, everyone. Hello?
Yes, we can hear you. Just go ahead and introduce yourself.
Okay. Hi, everyone. Good evening. My name is Pharmacist Nestor Nemekaugu. I'm currently a practicing community pharmacist in Nigeria. Thank you.
Awesome, awesome. And of course, I have my co-host with us today in the person of Mr. Alex. Go ahead and introduce yourself to our viewers.
Good evening, good morning. My name is Alex Mahiri. I'm a co-host of this program with my manager. Thank you.
Awesome, awesome, awesome. And before we bring in your manager, I think I see somebody that is also trying to connect. Is that one of our panelists that we are expecting?
Yes.
Dr. Lara Sodunola, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, but we cannot see your face.
Yeah, sorry, you can see my face.
Okay, so just go ahead and introduce yourself to our viewers. They are listening to you.
Yes, my name is Dr. Lara Shodrola. I live here in Dallas, Texas.
Okay.
And I'm a licensed pharmacist in US and also in Nigeria. I'm here to help with any questions as much as I could. Thank you.
Awesome, awesome, awesome. You are so welcome. So before we bring in Mr. Alex Manager, the host of Kina Earth Show, Dr. Kina herself, let's just play this tape. Awesome. You're muted.
Hello, everyone. Welcome back to our show. Welcome everybody from all over the world. and we want to share our concerns with our viewers, friends, and families in Imo State, Nigeria. Our hearts and prayers are with you at this difficult time. We also want to condole with the families that have lost their innocent loved ones due to the ongoing unrest. May God comfort you all and bring lasting peace to our land. Today, we are going to conclude on our discussion on our medication madness, focusing on more synergy between the pharmacist and other healthcare providers and their roles in the community. We have pharmacists from different parts of the world. You have met all of them, so I'm hoping that today's show will shed more light and give you more answers to your questions. Welcome.
Awesome, awesome, awesome. So without any further ado, I'm going to be stepping aside and let my co-host, Mr. Alex, answer this show. And of course, I'm his manager, Dr. Kina herself. So over to you, Mr. Alex.
Yeah, we are hitting the ground right away. Dr. Bika, I'm coming direct to you. Can you use about just 1.5 minutes or 2 minutes and give us a recap of what we did last 2 weeks so that we can take off from here? Thank you.
Sure. So 2 weeks ago on the last episode, we talked about what exactly a pharmacist does, especially in the community setting. And we talked about their role in the healthcare team, whether it's in retail or in the hospital or other settings that you can find pharmacists in. We also talked about the importance of pharmacists and what they do and how they can protect patients. We talked about things like medication abuse and medication misuse. We also talked about over-the-counter drugs that people may abuse and the importance of talking to a pharmacist about your medications so that you can take what you're taking safely. And another thing we talked about was the communication aspect between pharmacists and doctors. And what some people may not realize is how much communication goes on between pharmacists and doctors and how important that relationship is when it comes to helping patients get treatment and get better faster and stay healthy. So those are a few things we talked about, and today we're going to shed some more light on those topics and a few more.
That's okay. That's fine. That's fine. As the doctor Opera, let us start again and give more highlights of some of the critical role of the pharmacist in the healthcare delivery system. You may not have been on the program last week, but you watched him. So could you expand on some of the critical role of the pharmacy in the healthcare delivery system? Ugo?
Yes, I definitely was watching last week, and it was really informative as well. I know a lot of it probably was covered, but to kind of sum it up, and I think this goes for whether you're a pharmacist in hospital or a pharmacist in community or any other place, but pharmacists kind of act as like the safety net, the final safety net when it comes to healthcare. Like anything that may be prescribed or advised by another healthcare professional, eventually if the medication has to be supplied by a pharmacy, the pharmacist will be the one to kind of give that final check to make sure that this is clinically appropriate and to make sure that it's accurate as well and that it goes to the right patient for the right condition at the right time. That does look a little bit different when it comes to whether that's in hospital, whether it's in the community. My personal place of expertise is in the community, of course, but across the board, that's generally what it is. We are the final safety net to make sure that the right medication is going out in the right way to the right patient.
Okay. Has anybody anything to add on the critical role of the pharmacist? Yeah, Nestor, you are invited if you have anything to chip in before we go to Dr. Lara. We're still talking on the role of the pharmacist, the critical role.
You are muted. Can you unmute yourself? Can you unmute yourself?
Okay. Pharmacists, they are an integral part of the healthcare team, and they play major roles, especially in medication management. Everything that has to do with medication safety, effectiveness in patients. So first, pharmacists, they make sure that dispensing, storage, procurement of medications are in line with the regulation. That is one role they try to play. Again, they give advice on the use of drugs as regards the dose, drug interactions, any possible side effects of drugs, indications, and all that concerning drugs. Then they also advise other healthcare professionals on the kind of medications to use and their potential side effects as well. They take part in medication review. A lot of patients have actually died due to medication doubling. Some even take two different, like two different brands of a particular drugs. So without knowing, they don't know they are double dosing. So with the help of pharmacists carrying out a medication review on these patients, some of these problems can actually be. So the role played by pharmacists actually depends on the area of practice. To be in the hospital, community, industry. But in this context, I'm talking more about their clinical roles, especially in hospital and community. Also, in compounding of medications for patients, they try to compound medications according to individual specific needs. That is one thing they also try to ensure. Then drug therapeutic monitoring. They also monitor the effectiveness of drugs, their concentration, trying to make sure that those drugs are within the treatment range. They doesn't go beyond the treatment range and gets poisonous. They also try to monitor patients and make sure that the drugs they're taking are within the therapeutic range. So these are some of the responsibilities that pharmacists carry out. Thank you.
Yeah, Kina, I don't know whether you want to come in, but before you do that, I want to ask this question out of curiosity. From what you have said, the pharmacists play a very critical role and they have a lot of synergy with the doctor. But has there been any case of disagreement over a prescription? And if there is, how is it resolved? For instance, the doctor gives a prescription, but you as a pharmacist believes that it is not the proper thing to be done. From what you have said, that's part of your role. If there is such a situation, how is it resolved?
Okay, there have been several cases of disagreement between the pharmacist and the doctor, especially here in Nigeria, where communication among pharmacists and doctors is very poor. Like the level of trust, respect for each other's rules is not too there.
Well, any other person can chip in. We want to have people's reaction. Other pharmacists can chip in and answer this question from their experience. Yeah, go ahead, Opera. Yeah, go ahead.
Yeah, it is something that does happen quite a lot because we're the experts on actually what is right in terms of from a pharmaceutical point of view. And doctors, while they are great, they are not the experts in that specific thing. If they're the ones that are prescribing these things, by the time it gets to us and we see something that we think might be an error or a mistake, upon calling the doctor and speaking to them, we realize that they actually meant to do these things. And at that point, it does become a thing of what we know as correct according to what we've learned, versus what the doctor knows as right for their specific patient. And it depends on the actual situation, but sometimes it's a case of, this is not safe, we're not going to prescribe this, we're not going to let you give this out to the patient. And other times it's down to the autonomy of the doctor and also the patient. Because over here, at least, when in general practice, these doctors have conversations with their patients, there is a lot of opportunity for patients to chip in and be like, this does not work for me. I know my body, this does not work for me. And when it comes to that, as long as we're not doing something like letting someone overdose on something, Nestor talked earlier about the therapeutic window of something. Sometimes we see drugs that are prescribed that are below the therapeutic range. So while it might not be poisonous, we give it to these patients and it might not be doing anything according to what we've learned is the right therapeutic window. But in cases like that, it's because everyone's body is different, and some of these things may affect different patients in different ways. So while the majority of people, this therapeutic range is right for them, for some it's too high, or for some it's too little. So there is a lot of cases where the autonomy of the patient and the decision of the patient comes into play as well. All we can do is offer our expertise and really save someone if there is an error made, or if there is ignorance on the patient's part or the doctor's part. But we do also have to incorporate what the doctor believes is right for their patient and what the patient knows is right for themselves as well. So
that's perfect. That's good. Dr. Laura, you might get her to answer the next question on medication abuse.
Dr. Kina, you have to mute yourself. You are muted. You are muted.
Yeah, Dr. Lara, I wanted Obika to shed a little more light on what is obtainable from that last question that Udo answered, when there is a conflict between what the doctor thinks is right for the patient versus what the pharmacist thinks. Any input?
Yes. Far back in history, there's been the lack of respect to each other's profession. Like a colleague that said, there's been some arrogance noticed on the part of the physicians, especially the ones that are just graduating. We've been in the practice for so long, and then you see an incoming physician and they just want to practice what's on the protocol, which may have been outdated. There might be an updated protocol out there that they don't know about. But because they think, they know it all, they just coming from school and all of that, they don't want to stick to the advice. And at the end of the day, in my experience, they still come back to us and finally consider that advice in the best interest of the patient.
When you say they still come back to us, like who are those us?
They still come back to the pharmacist. Like I worked in the hospital for a long time, and then that's where I seen those arrogance in the new physicians. Like most of the time, they're the new physician, the resident doctors. So when we advise them on therapeutic alternatives, they tend to want to stick to the protocol they're coming out of school with. And then not knowing that there could be an update in the protocol, even since they graduated like 2 months ago. And then when we try to advise them on the current protocol, what the therapeutic ranges, they try to show some arrogance. And then all we have to do is document it. We want to document it to make sure we let them know. And then if anything happens, and it's not in the best interest of the patient, at least our documentation will speak for us. But most of the time, they come back and say, okay, we're willing to try, your therapeutic alternatives.
Okay. Obika wants to add to what Dr. Lara said.
Yes, I'll add that the documentation that she's talking about is something that's very important for the pharmacist in terms of liability. If the doctor prescribes something for a patient and then the pharmacist feels as if that's not something that will be safe for the patient or it's not in the best interest of the patient, what the pharmacist will need to do is have a conversation with the prescriber. And if there's still no agreement on what was discussed, we as pharmacists need to document that information and document that we had that conversation and what we talked about. So if anything happens to the patient, if it ends up hurting them or costing them a lot financially because of what the prescription caused or what the doctor decided the patient should take if it caused them any harm, it helps with the liability aspect because the pharmacist gave their input and the prescriber is still adamant about using the treatment that the pharmacist thinks is unsafe, then the liability would go to the prescriber first and foremost. Although the pharmacist might end up still dispensing that medication, there will still be a liability towards the prescriber before the pharmacist, as long as that documentation was made and as long as it's saved and it can be brought up if it comes to that court of law or whatever it may be, the documentation is very important for the pharmacist in that situation.
So if I may get you right, I know Dr. Kina has something to say. I could see her moving ahead. But now, so what you're saying is, okay, if a doctor or let's say prescriber prescribes a particular medication and you know that, okay, this medication or this prescription is not right for the patient, even though you have the conversation with the doctor, with the prescriber, and if two of you does not reach an agreement, you could still go ahead and dispense the medication, but you will now just document it at your hand. Is that what you're saying?
Yes, yes. And it also depends on the severity of the, say, side effects or allergy. Say, like in my experience working at a retail, I had a patient with a prescription for Viagra, and Viagra and nitrates are contraindicated, which means they cannot be used together. So I spoke with this patient. You're on a nitrates medicine for your heart, and Viagra is contraindicated in a patient on nitrates. And then he still wanted to go ahead and fill the Viagra. But I told him that I would need to speak to your doctor because he kept insisting that, oh, I already discussed with my doctor. That's fine. Just go ahead and give it to me. And I said, okay, I would have to speak to your doctor's office. And I spoke to them, just to remind them that Viagra is contraindicated in patients that are on nitrates for heart failure. And then, the prescriber was like, okay, we discussed that with him and he's willing to take that risk and go ahead and give it to him. And in such situation, I still went ahead and filled it for him. And he even went ahead and said, well, something's gonna kill me anyway. He might as well be Viagra. So I documented it and we still go ahead and dispense it to him.
Okay. Thank you for sharing that. Something happened last 2 weeks, not last week. All of you keep saying last week. It was actually last 2 weeks. So last 2 weeks, there was a topic that was raised, and I don't think we actually reached the conclusion of that topic. So now that we have Dr. Lara with us, and I believe we have Do with us, maybe Dr. Kina wants to bring back that conversation, that topic that was not really concluded, because I believe I was not satisfied as a person. Over to you. You are muted.
Yeah. So one of the questions that we went through last episode, we wanted to find out precisely what the Nigerian pharmacists, what their role is in prescribing or administering medication. So, Dr. Lara, you're licensed in Nigeria, and Nestor is here. So, can either of you shed some light on whether Nigerian pharmacists can prescribe medications as well as, filling the prescriptions?
In Nigeria, the practice is actually a lot different from the US. I guess it's because of the level of responsibility, liability. Everything is spelled out in the law on what you can do as a licensed pharmacist in US. It is also spelled out in Nigeria, but because the level of liability in Nigeria is very low, it's very hard for a patient to come back and sue you as a pharmacist or as a physician in Nigeria. So I see a lot of interwoven practices, like even the nurse can prescribe in Nigeria, like auxiliary nurses performing surgeries, for example.
It go work.
Some auxiliary nurses performing C-section, that kind of a thing. So in Nigeria, pharmacists are allowed to prescribe the OT, the over-the-counters, and some that we consider prescriptions here. But when it gets to like hospital-used kind of medicine, then they would have to get a prescription from their prescriber and bring it to the pharmacy. But again, even if they don't have prescription and it was dispensed, then so be it. But in America, strictly pharmacists can recommend over-the-counter medications, and they can prescribe. They can prescribe if they are in, we call it protocol agreements with a physician. Like if I'm in a protocol agreement to treat anticoagulation patients, I will have that protocol with a physician, and that's what I would prescribe. Like I could manage their lab work. I could manage their level of warfarin, for example. If they were on 10 milligram, I could change it to 5 milligram or 2 milligram. That would be a protocol agreement with their primary physician. And some other things that we're able to prescribe are like in some states, pharmacists are allowed to prescribe birth control pills. So you could just walk into a pharmacy and get your birth control pill filled without seeing a prescriber. And other treatment in that regard would be nicotine therapy, like people that are trying to get off smoking. Based on protocol, we can also treat them too. And there's something we call ambulatory care in the US, meaning patient in chronic illnesses like HIV or Hep C, for example. You will enter a treatment protocol with a physician, and they would send the patients to you, and you will manage them. You will manage their lab, you would prescribe to them, until the end of their therapy in the US. Thank you.
Wow.
Nestor, do you have anything to add?
Okay, like she said, in Nigeria, it's only doctors, dentists, some nurses in primary care facilities that have the legal right to prescribe medications. Pharmacist prescription authority is not yet in the legislation. So by law, pharmacists in Nigeria are not allowed to prescribe. However, they can recommend OTC medications for simple ailments with simple diagnosis. That's the case with Nigeria. But in actual practice, pharmacists, as aside OTC medications, they also prescribe some prescription medicines like antibiotics and some other prescription medicines. I'm talking about the real what is happening in Nigeria currently. Even patent medicine dealers, salary nurses, but so everybody almost prescribes currently in Nigeria. But by law, pharmacists are yet to be captured when it comes to prescription authority. Thank you.
Thank you. Lezana, you can take the next.
Okay, Udo, I'm coming to you right away. We want to look at medication abuse. What do you really consider to be a medication abuse, and which are those that are mostly abused? Udo, I'm coming to you direct. Can you take up the question? Yeah.
Okay, so medication abuse, the first way it comes to mind is, and it's not limited to, but the first way it comes to mind is overusing of medication, either for a desired effect or yeah, for a desired effect. And the ones that are mostly, I would say, misused but abused, at least over here, are those that are very addictive, those that will kind of give you like an altered sense of self. Usually it's things like heavy painkillers, which over here are seen as controlled drugs. Keep them in a cabinet, and they have to be signed in and out whenever they're given out, whenever we get them delivered in. And they are such because they are the ones that are most likely to be abused. It's not news to anyone that when you're in pain, you want to take something to get rid of the pain, but it's not news to anyone, especially in healthcare professions, that sometimes this is psychological. Like you can be going through this pain and then the pain can go, but something in your mind will still be telling you that you're in pain and you need to keep taking this medication. That's probably one of the most tragic ways that medicine abuse can happen, because people really believe they're helping themselves. But in such a case, they're just addicted to something that they don't need to be addicted to. So yeah, that's the one that comes to mind first when you think of medication abuse.
If you want to control it, what do you do? If you want to control medication abuse?
Well, on our part, we decide what we give out. Like, for example, if we see a prescription for like a heavy painkiller and we see it over and over and over again, and we start to like question, is this clinically correct? Is this something that someone should be on long term? And at that point, we can make interventions and step in and stop these people from getting that. Working in retail pharmacy, I work for Boots, which is in partnership with Walgreens over in the US. Walgreens Boots Alliance it's called. And in terms of selling things over the counter, they're very strict with us on the questions that we have to ask people and before we sell it. But we also have to keep an eye out for the people that buy these things on a regular basis. Things that are based with codeine, in my experience, are the ones that people will come and ask for every single week. And every single week, I'm having to turn people away and say, no, you're not meant to have that. We sold it to you last week. You're only meant to use it for 3-4 days in a row. And we gave you enough for much longer than that. So you shouldn't be back already. So in terms of how we can control it from a healthcare point of view, it stops with us, because we're, like I said, the final safety net before these things go out to these patients. So it takes us saying no to the people.
Okay. Has anybody anything to add to the discussion, or do we go on?
Yes, I was just medication abuse would be literally defined as long as that medication is not used as prescribed by the prescriber, then it's an abuse. say you were supposed to take medication 1 time a day and you're taking 2 times a day, then that's an abuse. Or if you were supposed to just take it by yourself and then you share it with family member just because you think, whatever you're going through is what they're going through, it's an abuse. Yeah.
So in checking it, can you give us one solution?
Yes, in checking it, the major way we do that is what Udo has mentioned about making sure they're not refilling early. Like if you had a medication that was supposed to last you for 30 days and then you show back in 2 weeks and you want some more, then the pharmacist will have the record, so they won't be able to give it to you. So that you're not having too many medications sitting around.
Okay, that's okay.
Well, yeah, Dr. Lara, while we're on that topic, recently, I think we have had some patients complain that the pharmacists are not refilling their medications, or especially narcotics and benzos. They would say they only gave them 7 pills, but my doctor wrote 30 pills. Does the pharmacy have a right or a power to decide how much medications that the patient is going to be given, despite what the prescriber wrote?
Actually, it's not always the pharmacy that is making that decision. It's either their insurance company or the company policy. Like if I was working with Walmart, and Walmart pharmacist company policy is to give 7 days supply of narcotics, especially in naive patients, meaning that they're not chronic on it. If it's a new prescription for them, we want to give them 7 days supply first, and then they would have to go back to their prescriber and get another prescription if the prescriber still feel the need for them to continue that same medication. So it's not always pharmacist decision, because by state and federal law, we're allowed to fill it. But then you also have to take into consideration the insurance policies, the insurance company's policy, and then the company policy.
Okay, great. Obika, do you have anything to add to that?
I don't have much to add. Dr. Laura is right. A lot of the times that is the insurance company that is limiting that supply, along with some company policies like Walmart. And that is all just made because of the fact that many people abuse those types of drugs like opioids and benzodiazepines like alprazolam and temazepam, things like that, clonazepam. So it's actually, in my opinion, a good thing that they're doing that. Sometimes it's overkill at times, but the mindset is good because many people abuse these drugs and it's caused a lot of pain and suffering and cost for a lot of people. So the fact that insurance companies and full-blown retail companies like Walmart are doing things like that, it's progress in my opinion because of the fact that it can save lives and help people not to get addicted to some of these drugs.
Wow, powerful. So let's move on by talking about self-medication. So what are the dangers of self-medication and how can it be discouraged? What can be done? Is there anything that the pharmacist can do about it? Or, I mean, let's just talk about the self-medication generally. I think Dr. Lara should start.
Okay, thank you very much. Self-medication is is dangerous in itself, because a lot of people are on other medicine that are the same ingredient as what they are trying to self-medicate on. An example would be Tylenol. A lot of pain patients are already on Tylenol, but because they're getting the medicine under the brand name of, say, Pharmacists, they don't know that they're already on Tylenol, and then they want to go to the store to get like NyQuil or something that has a lot of Tylenol ingredients in it. And then they add that to what they already have, and the side effect of taking too much Tylenol, because there's a daily limit, which is 4 grams. It's liver damage. So you could be damaging your liver without knowing it. So that's why self-medication is not advised unless you know exactly what you're doing.
So thank you so much for sharing. Before others, contribute on that topic, so I know there is also herbal medications or herbal supplements. I mean, during COVID, there were a lot of self-medications that proved to work. So what will you say about all of that?
Herbal supplements are okay if they don't interfere with the medication that you're already taking. Like some herbal supplement, like even grapefruit juice that a lot of people normally have with their breakfast, could interfere with, say, Lipitor, which is cholesterol medicine. It can actually put you overboard, and then it's working your organs, overworking your organs. So herbal medicine, a patient that's on warfarin, for example, the rule of thumb is for them not to be on any kind of herbal medicine, because the therapeutic index of warfarin and some other medicine is very narrow. So you could easily push yourself over, and you're actually overdosing, and that person could lead to death.
I believe Mr. Alex can relate more with this one. When we talk about herbal medication, let's go a little bit traditional. So there's traditional medication also. It's a little bit different to herbal medication. So how do you combine this? And can it be abused because there's no dosage? You just take it as you like. Like, I mean, I go back to COVID, the concoction that we prepared. What category is that? Is that herbal medication or traditional medication? Dr. Lara?
Yes. For patients who are otherwise very healthy, like before COVID, you are not on any medication, you're just healthy, then it'll be safe for you to prepare concoction and use it. There are so many immune boosters out there, like echinacea, that I always recommend for people. If you're not on any medication that can interact with it, then yes, it's fine for you to use it. And they do help. They help to boost your immune system. So that way, if COVID was coming, you wouldn't get sick. You won't get hospitalized, because of that. But our concern as a pharmacist are the patients that are on other chronic medications.
Okay. Does any of you wants to add to that? Okay, go ahead, Udom.
Yeah, I just want to add that generally I can't speak for anything that I haven't done research into or that my profession doesn't do research into. So when it comes to a lot of herbal medications, I don't want to be quick to say, oh, that's bad, don't take it. And to echo what Dr. Lara said, yes, a lot of them are useful and a lot of them do help. But when it comes to patients that have chronic conditions, the one thing I say to them is do your research to find out if this interacts with anything that you're taking. And even then, even if you're sure it's not, do monitor your vitals once you start taking that thing. So for anyone that has high blood pressure that takes medication for that, while you're on this herbal medication or this traditional medication, check your blood pressure on a regular basis, maybe even more so than you do before. If you see that it's affected by what you're taking, then maybe stop and think. I say the same thing for anyone that has diabetes and their blood sugar, and anyone that has high cholesterol and their cholesterol, because there's very much ways of doing this. You can buy machines in most shops. You can buy like blood sugar testing machines in the same place, and even home cholesterol testing kits as well. So for all these sort of things and the like, I always say double check your vitals while you're on these medications, rather than just not take them, because you could be robbing yourself of something really good if you don't take some of these things. But do monitor your vitals while you're on these things, because a lot of people were so scared of COVID that they're willing to try anything. I saw so many old wives' tales and so many like remedies appear on my WhatsApp that I was rolling my eyes at, because I knew there was no research into them. They were all like, there wasn't much to them basically, but a lot of people would swear by them, sometimes at the risk of their health. So yeah, when it comes to those sort of things, they're not a bad thing, but always be sure of what you're putting into your body, and there's ways to check, as I've said.
Okay. Yeah, before I yield to Mr. Alex, now that you made mention of expiration, so let's assume a medication is expiration date is written June 6th. So how long after that date of expiration can that medication still be used? Because I've heard many people say, oh, you can still take it at 6 months, 3 months, or 1. So can that medication still be taken after the expiration date that is written on it? Anybody
Yes,
can? Okay.
yes, it can still be taken, but I want maybe a month or 2. 3 months is going overboard, because those pharmaceuticals are they're chemicals. So the expiration date means they're stable for that long. So if the expiration date is 1 year, that means they're stable as that chemical for 1 year. So your Tylenol could be reacting with the hair and turning into some other chemical. So to be safe, I would say a month or 2. 3 months is going overboard. And the reason being that it's not as effective and it's not as stable after that expiration date.
Awesome. Over to you, Mr. Alex.
Yeah, I want us to look at this issue of polypharmacy. I've been hearing about this polypharmacy. So what does it really mean, and where does it come in the healthcare delivery system as far as the pharmacist is concerned? Nestor, we may have to start with you, but everybody has to take a shot at it.
Okay, polypharmacy simply means taking multiple medications at the same time. Taking up to 5 medications at the same time. And it's mostly seen among elderly people who have comorbidities, like who are suffering from different chronic diseases like hypertension, diabetics, hyperlipidemia, and also those elderly patients who are seeing different doctors or specialists. So this one we prescribe, another specialist we prescribe. So you find out that a patient can be on up to 9 medications, all taken at the same time. So that is what polypharmacy means. Thank you.
Yeah, I want to invite other people to contribute. Who wants to contribute to this?
Yes, as Nestor has mentioned, polypharmacy is mostly seen in elderly patients. That does not mean some young people don't take many medicines too. It's polypharmacy come with comorbidity, meaning that you have different diseases at the same time. So you could be taking medicine for diabetes, high blood pressure, cancer, even at the same time. So that is polypharmacy. And a patient on polypharmacy should always go for, like in America, we do something called medication therapy management. So when that's is an expert in the area of the pharmacist. So patient will come in, the literal name they give it, especially among the geriatrics, the elderly, is brown bag. They call it brown bag review, where they will bring all their medicines from Dr. This, Dr. That, Dr. That. They'll put it in a brown bag and they will bring it to the pharmacy. And then the pharmacist will review it. And if there's something that they don't need to be on, or if there's an addictive effect, or if the medicine is just not doing any good, maybe it's doing more bad than good, the pharmacist is supposed to catch that and then review that with the patient and the prescriber. And any changes that needs to be made, could be made. And then the goal is to have them on as less number of tablets or different treatment as possible.
Okay. We have pharmacists from United Kingdom, Nigeria, and the United States. And I want to believe your challenges differ according to your environment. So I will invite Udo to let us know what are the challenges you face as a pharmacist in the United Kingdom. And then we also invite those from the United States and those from Nigeria. So Udo, we start with what challenges are the peculiar challenges you face as a pharmacist in the United Kingdom?
Yeah. A lot of people talk about respect from their peers, and once or twice I've experienced challenges with regards to that. But I think mostly what I face on a daily basis is respect for the profession from patients. A lot of the time, people come in and say, "Oh, I'm only here because I couldn't get through to my doctor, so you're going to have to help me." And sometimes it's the thought or the assumption that we don't know as much as doctors, or we can't help patients in the same way that doctors can. Sometimes it comes off as a bit patronizing, and it's something that me personally have gotten used to. But I think it will be better if more and more people start to realize that us as pharmacists can do a lot for patients, a lot more than their doctors can do in some cases. But I think that is the main challenge that comes to mind on my part. A lot of people don't take us seriously. And even with the advice that we give them, sometimes they usually say that they're not going to listen to us, especially if it's something they don't want to hear. And they're going to go to their doctor and get something else.
Okay. Nestor, let's get your peculiar challenges as a Nigerian pharmacist. I know there could be plenty.
Thank you. Actually, we have a lot of challenges here in Nigeria as pharmacists. If I start mentioning them, I don't think we might actually.
We will not finish.
But then let me point out some of the
just mention the top of the list.
Okay, like here in Nigeria, where we have a chaotic drug distribution system. Drugs fly in from different corners. There is no programmed or standard routes through which drugs flow. So you find out that up to 70% of medications in Nigeria are not even in the hands of pharmacists. So it's a very big challenge, and it's encouraging all this self-medication, medication misuse and abuse. We are in a very serious competition with non-professionals here in Nigeria. Then secondly, poor remuneration. That's a major challenge too. Then poor infrastructure. Find out that if you go to healthcare facilities like hospitals, see them establishing good offices for other departments, but when you come to the pharmacy department, you just see one cubicle. So the pharmacist he finds it difficult to, get enough space to perform his clinical or administrative roles. It's a very big challenge here. Then work overload. You see a hospital having only one pharmacist and a lot of patients trooping in and out of the pharmacy. So where would the pharmacists have chance to, do the proper medication management and drug therapy resolution and all that? Found out the pharmacists will be struggling to dispense the medications first to patients before any other rules. So it is a very big challenge to pharmaceutical care, which is the professional steps that pharmacists take to optimize therapy for patients. Then here, lack of support from government, lack of support, postgraduate, as a pharmacist, for you to run postgraduate trainings, you have to do that yourself. Staff development is poor, poor funding or support for research, poor support for all this continuing development program or continuing education program. Then pharmacists here are still struggling to establish an identity for themselves. Most times in hospitals, they are still seen by other.
I believe he will come back. He was just talking about the challenges that they have. Is the problem he's talking about is not actually only for the pharmacists. I think it's a general problem. That's one of them right now that just happened. Is the Lord will help us. Okay, Dr. Kina, over to you. You say you have a question you want to throw. You are muted.
Let's go ahead and get to Beaker, Dr. Lara's perspective on the challenges that they face here in the United States, briefly.
Okay.
Sure. One big challenge I face in my practice is the workload, like Nestor mentioned. That's one of our biggest challenges because, at least for the retail pharmacies, they expect responsibilities to increase for pharmacists, but they don't want to give them enough support as far as technician hours and enough staffing development to help get those responsibilities taken care of and get the duties that they'd like for us to do in a timely manner done. And it makes it hard when they don't offer us enough support. So that's one of the biggest challenges I face in retail pharmacy.
Workload. Dr. Lara?
Yes, he's very right. I've been there, but right now I operate an independent pharmacy, meaning that I own it, and that has its own challenges too. You have to do most of the things yourself. There's a lot of paperwork involved and things that are in the corporate section. You have different offices that does things, but in an independent setting, you pretty much have to do most of those things that you cannot delegate by yourself. And then the insurance company, it's a big challenge because they don't want to pay, just to put it in the simple English. They don't want to pay, and then the patient is looking at you like, okay, where's my medicine? And then you don't know how to explain to them that the insurance don't want to pay, and that's why they're not getting their medicine. And the reimbursement keeps shrinking and shrinking every single day. But in recent times, the Texas Pharmacists Association was doing a lot of lobbying with the legislators, and they were able to pass some bills that would help the pharmacist and the patient. about the insurance companies, and there are some things they cannot do anymore, like steering patient to their own pharmacy. Because in the past, patient may want to go to an independent pharmacy and the insurance company want them to go to, say, like CVS. So they would not be able to do that anymore. So the insurance company is a major challenge in independent pharmacy.
Oh, wow. Yeah, I know we're running out of time, but I wanted us, because this is a major problem, and I would like for us to shed a little light briefly about most of us, many people take Motrin or ibuprofen whenever we get headache, and there are other medications over the counter that they take. So as pharmacists, can you all please just shed a little light and the consequences of taking too much Motrin, ibuprofen, whatever, and other medications that people might be taking, not knowing that they have the same ingredients. Dr. Lara shedded a little light on Tylenol earlier, and I wanted us to just run through about Motrin and ibuprofen.
Okay. So ibuprofen,
I think she's having an issue with her internet.
Obika, you can take it up.
Sure. So taking ibuprofen in higher doses or amounts that you should be taking can hurt different parts of your body, like your digestive system or your hormones, and it can affect your heart or your cardiovascular system as well. And if you take enough of it or too much of it, it can even be deadly. So even on the box, it tells you the recommended dosing, but I recommend talking to your pharmacist about what you're taking, because a lot of these drugs have different brands, but they're the same drug. And some people might not know that. Different brands, just different people making the same drug. So it's important to know what you're taking, what the active ingredient is in what you're taking, so that you don't take too much of it and hurt your body.
Yeah, I concur on that one. And working for like a big chain like Boots or corporate, they have so many systems in place to help us actually do this, both us as pharmacists and our technicians and our dispensers as well. I know we talked about Viagra earlier, which we do sell in the UK as well. But anyone that wants to buy such a thing has to fill out a form. The form usually says, are you of this age? Do you take this medication? And it does mention nitrates, as Laura mentioned earlier. And it basically makes it easy enough for you to say, if you are of this age, or if you do take this particular medication, or if you don't, then you can't sell this to this person, because at that point it can become deadly or they could hurt themselves. So there are a lot of tools in place to help us do this. But yeah, it really is important that we ask the right questions before these things go out. To echo all the brand things, paracetamol is the main one that I see a lot of the time. People buy things that contain things like pseudoephedrine, decongestants, and other things, but that also have a pain relief component as well. A lot of the time, I'm finding myself having to say to people, do not take this with any other paracetamol products. And you do that, get the odd case where someone says, oh, I didn't know that contained paracetamol, or I didn't know that the one I'm taking would contain paracetamol. So that's where this whole safety net thing that I keep talking about really hits home. Like, you really are saving lives on a daily basis, even if it just feels like you're selling day nurse and night nurse over the counter.
All right. I hope we I'll be able to do justice. It's a wide topic, but at the same time, I want to believe that our audience have gotten one or two tips from today's show. So let's say, okay, somebody has been with us and this person, has not really gotten anything, as I usually say. what would be your take home for our audience? Okay, what will you say? Okay, just one thing that you want our audience to go home with. Let me start with Udo.
The one thing that comes to mind is your pharmacist knows a lot more than you may think. So any advice that you need, definitely come to them. They know a lot more than you may think.
Awesome. And Obika.
I would advise people who take lots of medications or any medication to know what you're taking. And if there's any doubt or questions about what you're taking, know that the pharmacist can be a drug expert for you to help you with any issues you have with those medications.
Awesome. Before I forget, that's a nice haircut anyway, by the way. Just to throw it right there. Just to throw that right there. Even Udo agrees with that because I can see him nodding his head. Okay. So Dr. Lara, you there?
Yes, I'm back.
Okay, so what would be your take home for our audience? Just one point.
I would say when in doubt, just ask your pharmacist. It's only a phone call away.
Awesome. Okay, and Mr. Alex, what would you say your take home?
My take home is you be in regular contact with your pharmacist.
Regular contact with your pharmacy. Okay, Nectar is back, and we're just rounding up, but thank God that you come back. You are telling us about challenges in Nigeria, and I said, well, that would be a topic on its own, but you just experienced one of the challenges. So what would be your take home for our audience today? Are you with us?
Yes.
Okay, just in one line, what would that be a take home for your audience today?
Okay, I want to encourage my dear audience to always talk to their pharmacist about their drug-related problems.
Okay.
They shouldn't take their pharmacist for granted. They can actually save their life. They can actually prevent some medication errors they make while taking treatment. That's my take home for them. Thank you.
Awesome. And it's been a wonderful time hosting today's show once again. Join me as I bring back the host herself, Dr. Kina Omeneko. You're muted.
This was a wonderful show. I thank all our viewers and our panelists for doing justice to this topic. And I know that our viewers, they got a lot of good stuff from today's show. What I want to also mention for all our viewers is to make sure whenever you go to your doctor, take all your medications with you and all your supplements. The supplements are as important as your medication because of the various topics we covered today, interaction with the medications, and always visit your pharmacist with your brown bag so that they can look at everything you're taking and they can advise you. So I hope that everybody will be safe with taking their medications, and we'll see you all in the next 2 weeks.